Hi, I am Dr. Himani Sharma. This is a video of robotic-assisted hysterectomy. Here, I am using the Da Vinci XI surgical system of robot, which is the newest generation of robots. This is a case of benign endometrial hyperplasia. Hence, we have planned for hysterectomy with bilateral salpingo-oophorectomy. The surgical steps are going to be same as we see in a standard laparoscopic or open hysterectomy. So I am here to discuss more about the robotic instruments. As you can see that there are two robotic instruments. In my right arm is the monopolar scissors where the energy source is monopolar. These are very fine scissors helping to cut and also used as a knife. In my left hand is the fenestrated bipolar graspers. They have bipolar energy source and help in coagulating the vascular structures. After dividing the infundibulopelvic ligament, here I am trying to separate the bladder flap away from the uterus. So the port placement in robotic hysterectomy is more or less same as laparoscopic hysterectomy, where the camera is inserted through a supraumbilical port which is 8 mm, and there are two lateral ports in the same line as in the supraumbilical port, and these are also 8 mm. One assistant port is in the right lateral area, that is 5 mm port, and through which a laparoscopic instrument is introduced. The beauty of robotic technology actually is the precision and the efficiency. It visualizes everything in a three-dimensional view, and hence I am able to skeletonize the uterine vessels to a very great extent. It minimizes the blood loss, and hence the patient recovery is very faster. As you can appreciate that both the robotic arms are controlled by me, hence there is no shake in the instruments. If you compare it with the assistant instruments, you will notice a big difference between the stability of these instruments. Another advantage is that the camera magnifies the view and the surgeon's eyes are very close to the working area. So it helps to visualize the minute vessels. We also need to keep in mind that even the blood loss appears to be more, but actually it is not. The average blood loss in a robotic hysterectomy is approximately 40 to 50 cc. An interesting point here is, which actually you cannot see, but as a surgeon, I am looking everything in a three-dimensional view. So the camera which is inside this patient's belly is a binocular two-eyed camera, and that camera sends two video feeds into a console, which is the surgeon's console where I am sitting and operating. So I am looking into a console where two images are fused into a three-dimensional view. So not only I am seeing in a high definition, but also in a three-dimensional view. Another advantage is that camera is controlled by one of the robotic arms. So you can see that there is no shaking of camera, which is in contrast to the laparoscopic surgeries where the camera is under assistant controlled and we have to guide the assistant where to show. One of the key of these technique is the precision of the technique. As you can see that this is a very straightforward operation which I am showing right now. It's a benign hysterectomy, but the precision is very important in more complex cases such as endometriosis with in dense adhesions, CA endometrium, where we need to operate in the vicinity of vital organs and protect them from injury. So magnification plays a big role. The degree of freedom of movement of these robotic instruments is too much, and it allows us to operate in deep pelvic spaces behind the uterus. So this grasper acts as a suction also, and by blunt dissection I am trying to separate the bladder away from the vagina or the cervix. Here the vaginal vault is being opened through these very fine monopolar scissors. Again, very nice pinpoint precise control of instruments. Surgery time approximately is around 1 hour. The only extra time which is there in robotic hysterectomy is the docking part. So once the ports are placed, we have to dock the robotic arms to these ports. This is my 5th case of hysterectomy. In the first case, the docking time was approximately 40-45 minutes, but with increasing experience, I could dock the robotic arms in 20 minutes. Hopefully, as the experience increases, the total surgery time, including docking, will also reduce. The limiting factor obviously is the cost of the robotic hysterectomy, but as any other novel technology takes time to get established, there is hope that this technology will also become cheaper and will benefit our patients. Now the vaginal vault is cut. Here my assistant is holding the cervix through a grasper, and the specimen will be removed through this vaginal tube. The suture material which I will be using is number 0 V-lock self-locking suture, and the suture material is also introduced through the vaginal tube. Another advantage is for those surgeons who are not comfortable in laparoscopic suturing, which requires years of practice, as these are non-wristed instruments. But the advantage of robotic instruments is that the dexterity and the freedom of movement which is allowed at the wrist. This allows the surgeon to do suturing in a very comfortable manner, and it mimics the same extent of movement of wrist which we have learned all through our career in a open surgery, like driving the needle through the tissue. The only difference is that you have complete control over the needle. As you must have noticed that I have changed my right hand instrument. Instead of the monopolar scissors, I am using a needle driver now and taking continuous interlocking sutures. The advantage of robotic hysterectomy, which I have observed in my 5 cases, is that the post-operative pain is very minimal. Hence, the requirement of painkiller is too less, and patient can go home either the next day or on 3rd day. Hence, the recovery is wonderful and the outcome is very rewarding. As with any new technology, there is a learning curve. So, as we do more and more cases, we will be in a better position to speak about this technology. It is mainly rewarding in complex cases. This is the final picture of vault. I hope this video is helpful. Thank you for watching.